Welcome to our session today on understanding your child's diagnosis. And we're looking at it from a neuro-affirmative perspective. So I'll share the slides with you now and then we can get started. Okay, so my name is Kate and I'm a psychologist here at Inspire Therapy. I'm also the clinic director and owner of the clinic. We provide multidisciplinary supports to families. We provide psychology assessment and counselling support. We also provide different therapy supports to students at schools, speech and language therapy, occupational therapy, learning support, behaviour support. So we provide lots of different supports depending on what each individual child and their family needs. I've been operating, or the clinic has been operating since 2015, and I've been working in this field with children with autism for about 20 years now. So I'm very passionate about this work, and I really enjoy supporting families and children in the school environment and enabling them to have a successful time at school. So today in our session, we're going to have a look at understanding a child's diagnosis, and we will talk about what the diagnosis means. We'll look at how autistic children experience the world. We'll look at practical support at home, advocating at school, building a positive autistic identity for your child, and then questions at the end. And we will do this through a strengths-based approach. In our session, we want to build your understanding about your child today. I know that many of you may be at the start of this journey. Some of you may have already received a diagnosis. So depending on where you are, I hope that it will be helpful and that you will get some suggestions and tips of things to try at home. We will look at practical tools that are research-based and based on the lived experience of autistic people themselves. And these will be used to give you some suggestions and tips for what you can try to support your own child. All questions and opinions are welcome. There's no wrong feelings, and I'm sure that there's going to be a mixture of feelings, and that's totally understandable. We follow the child's lead, including on language. So with that in mind, you may hear me saying an autistic child rather than child with autism. Both of these terms are used at present, and ultimately it's the decision of your child and your family how you wish to term this. Again, we do it in a respectful way where we try and take the child's needs and wants into consideration and ask them the questions so that we are better informed to label things in a way that they feel comfortable with. And with neurodevelopmental conditions, we're all learning together, and it's a process that's an ongoing process. To start with, then maybe have a think about how you're feeling about your child's diagnosis today. And again, feelings can change. You may be feeling a mixture of all of these emotions, and some days may be more difficult or easier than others. And it's just good to give yourself some space to process all of that information, all of those feelings. They're all justified and valid. And the more we can understand ourselves and how we're feeling, the more able we are to be present and supportive for our children and on their journey too. So for some of you, you may feel relief because you've had a lot of questions, maybe about behavior, about certain concerns you've had, and now you're getting an answer to those questions. And it's important, I suppose, to be patient with yourself as well, because you're going to have lots of new experiences coming up, and the feelings may change as we go along as well. You may feel overwhelmed. There's a lot to take in, lots of information. You may be given lots of recommendations and suggestions. It might feel it's urgent that you look at all of these things today, and it's hard to know where to start sometimes. You might feel hopeful because you now have more of an idea of what to expect or a pathway, and it might give you some more general guidelines and direction about where to get information moving forward. And this can be a positive thing because you feel a bit more empowered now that you have a diagnosis. You may feel worried about the future, and that's understandable. Uh, Autism is a lifelong condition, so it's good to think about where you want your child or the pathway you want them to follow as well. But again, sometimes we can start to think too far ahead, whereas when we can see what's in front of us at the moment, it gives us a good place to start. But again, concerns about the future are very uh, normal, and you may be thinking about things like what will they be doing in 20 years' time? Will they have a job? Will they have a partner and things like that? So that's very normal as well. You may feel confused. You're still trying to understand what the diagnosis means. Um, you may be unsure about certain aspects of it. How does that impact your child? Maybe some things you've seen really strongly apply and other things not at all. And that can be confusing because every child presents in a slightly different way. So something that you see for your child or something you've seen with someone else who has autism may not apply to your situation at all. So again, trying to figure out where your child fits within this overall spectrum. Okay, so the diagnosis is a description, not a destiny. And what we mean by that is that every child is going to present in a different way, and it doesn't give us an indication of how they're going to progress or how things are going to develop. So it's good to keep that in mind. The reason that we have the diagnosis is to give us a place to start from. Autism is a different way of processing sensory information, social information, and in terms of the brain, how we process things cognitively can be different as well, slightly different as well. Um, by understanding the different elements and how they interact with each other, it gives us a better understanding of our child. And by us building our understanding, the aim is that we can help them to build their understanding about who they are as well. It's a neurodevelopmental condition. It's not a disease. It's not a disorder to be cured. It's a lifelong condition. And sometimes we've seen things in the media that it can be caused by vaccines or too much screen time or parenting or things like that, which isn't the case. I think most up-to-date research says that it's to do with genes and the combination of genes and how they interact with each other, but they are not 100% sure on what specific genes that are interacting with each other because I think it's over uh, hundreds and hundreds of different combinations. However, we do know from research and just from practical experience that often when an individual has autism, there can be some prevalence of it in the child's family as well. Autism is present from birth, but it can be a situation where it's not identified until later. Sometimes it's when language skills are delayed or a child starts nursery or school, and then the presentation or the behaviours are a bit more obvious at that point. So what the diagnosis can give us, it's a framework to help you to understand your child's behaviour and help you to better understand what they may be communicating to you and what supports they may benefit from. It helps us to understand what supports we need to get access to. It could be speech and language therapy, it could be occupational therapy, it could be behaviour support. Again, by having a diagnosis, it helps us to start to piece together the different supports that may be beneficial for your child. And it gives us a way to help our children understand themselves, particularly as they grow up and move through school, that they can see that they're brain is processing information in a different way, and this helps them to be a bit easier on themselves. So we want to see it as the beginning of a conversation, not a specific label, and that's it. And what we know about autism, just in general, is that it tends to be, at the moment, the statistics are about 2% of the population. So that's 1 in every 50. However, these statistics have changed quite a bit in the last few years. So I just say that with a bit of caution, that it may even have changed by the time you watch this video. Generally, boys are 4 times more likely than girls to be diagnosed. However, more recent research is indicating that this may be because girls are better at hiding or masking symptoms than boys, and that's why it can show up as more prevalent. So, what it doesn't mean in terms of the diagnosis is that it doesn't tell us what the child's going to be capable of or their potential. It doesn't predict future relationships, happiness in terms of hobbies and interests and interacting with other people. It doesn't mean that your child's not going to have a rich and full life. It doesn't mean that your child needs to change who they are, or that we need to uh, change how they're showing up. It means that we need to provide supports around them to help them be more successful at school. And this is part of a neuro-affirmative approach, that we see that our role as specialists is to help set up accommodations so that children have a positive and successful experience of school. And again, when a child is diagnosed, it doesn't change who they are as a person. They're still the same person at the end of the day. But we need to adapt how we support them and our expectations in terms of the environment as well. We need to change that to help them feel supported and happy, and that they're going to enjoy their time at school, for example. Okay, we'll have a look at a short video clip now, and it's from a TED Talk. So I want you to look at this video. It's from a developmental pediatrician, and I want just to have a think about, what does she say about expectations of parents? Why is it important to speak to clients directly? And what does she say that when she speaks to individuals or people with autism, what they wish they could tell their younger self? So I'll get the video ready for us now.
Let's start with the child. One of the many wonderful things about being a developmental pediatrician is getting to see children progress over time. Barring rare, unusual conditions, all children progress, but their rates of progress may vary and come in fits and spurts. Expecting children to progress, to gain new skills, and to manage their behavior contributes greatly to their progress. If we don't expect them to progress, how can they? Children control 3 major areas that significantly impact families: when they sleep, what they eat, and when and how they use the bathroom. One of the things I've told my patients' families is to maintain their expectations that their children will make progress in these areas. They will learn to sleep through the night. They will eat a wider range of foods, and they will learn to use the potty. At the same time, parents and caregivers were teaching me about how they came to maintain those expectations, including the mother who said, "I don't treat him any different than any of my other kids." Or the mother whose young adult son often said, "But I have autism," in response to things he didn't think he could do. To which she responded, "I don't care." My patients have taught me a tremendous amount about the prejudice of low expectations, sometimes referred to as the soft bigotry of low expectations. This can apply to many groups, but it definitely applies to people with disabilities. If we don't expect someone to accomplish something, the likelihood that they won't is pretty high. I have many patients that communicate using a keyboard, typing things they wish to express. Some of my patients are a little particular about who they will communicate with in this way. I asked one of my patients, what helps him communicate with certain people? And he typed, "It's the feeling that they believe in me. It's the feeling that they believe in me." I teach our residents and medical students to assume competence when they enter an exam room to see a patient with a disability. Talk directly to the patient first, not their parent or caregiver. I have patients that have grown up and gone to college, some that drive, many that attend day programs, some that make their own podcasts, and some that still require a significant amount of support and supervision. I have some patients that are employed, but many more that are not, but could be, I'm certain of it, with just a little support and understanding. In our clinic, we have 2 employees, Nate and Raphael, and they keep our clinic running. Raphael greets everyone that works in that clinic, the doctors, the nurses, the medical assistants, and even the rotating residents and medical students once he learns their names, with a daily affirmation. Hi, Dr. Manning. I like your hair. I like your shirt. I like your shoes. You're my friend. It's wonderful, and it absolutely never gets old. I recently retired, and as I said goodbye to patients and families, some of whom I cared for over 20 years, I asked them, what would you tell your 20 years ago selves? Every one of them shared some version of, it's going to be okay. One mother shared, I didn't even know what okay was, but it's going to be okay. I couldn't have predicted the joy that she brings us. Not the sappy thing, the real thing. Immediately following that, I asked her daughter, Lydia, who has autism, what I could be to her if I wasn't going to be her doctor anymore, sort of baiting her to say, my friend. I said, Lydia, what can I be if I'm not going to be your doctor anymore? I can be your... Lydia responded, real estate agent? Her mother and I howled with laughter and joy. You know, okay may not sound like a very high bar, but you have to understand when families receive the news that their child has a developmental disability, they are in completely uncharted territory and they fear the worst. But as time passes, the unknown becomes known and things become a little less scary. There will be challenging times for sure, but the children will still grow up, progress, and live their lives, which is all any parent can hope for.
Okay, so we'll pause that. I'll reshare the slides and we'll just have a quick look at the questions that we shared at this before the video. What does she say about expectations of parents? So in the clip she talks about how when we have high expectations for someone, that gives them a much greater chance of being successful. And I think it's just really hones in on the kind of self-fulfilling prophecy idea that if we believe and set high expectations, it's more likely that we're going to be successful. So it's good to keep that in mind, that children are going to make progress. And as she says, it can be in fits and bursts. However, we should expect that, particularly when a child is young and they're in the school setting, that this is the time when we can teach them many things. Why is it important to speak directly to clients? It shows respect and respect for them as an individual, but also respect for their opinion and their right to decide how their own program is going to develop and in what direction. And that can be things like including children in their own goal setting, getting them to be part of meetings as much as we can, to give their feedback and give their preference wherever we can. What does she say that clients say they wish they could tell their younger self? And she mentions that things will be okay. And again, it's obviously we're going to have times where emotions maybe we're not in a good place and our emotions are up and down. However, like she mentions, we want to see children making progress, being happy, having lots of different opportunities. And when we provide supports and work with that goal in mind, then things generally do work out okay. So I thought that was a nice clip to share just because it touched on some important points in the video. Just before we keep going, I want you to have a think about some of these questions. So, since receiving my child's diagnosis, the one thing I have understood about them that I didn't before. So, what was the moment something clicked about your child? What do you wish their school understood about them? What does your child do that you now see differently? So, have a think about the answers to those questions and even write them down if you want. And what I think generally some of the feedback from looking at these reflections are that um, when you look back, it helps to put into perspective what you have been seeing with your child maybe over the years. Um, we find that schools generally are very supportive and helpful and on board with making accommodations that we request for students. But parents often feel like their requests are not being heard as they would like. Um, and maybe the school have their own perspective on things. With this content today, I hope it will give you some ideas of things that you can go back to your school with and set things up in a way that they can understand what you want and what your child needs. What does your child do that you now see differently? So, again, by building your understanding of what autism is, things that you maybe were unsure about now make a bit more sense to you. And I hope after the training, you'll have that perspective a bit more as well. With autism, often we see that autism is a spectrum of presentation. So children can present with different types of symptoms depending on where they are on the spectrum. Alongside that, then we see that children can have varying sensory experiences as well, and that can be for some children they may have some mild sensory uh, needs, and others may be more significant. And when we support children in helping to regulate that sensory input, it can have a huge positive impact on how they access learning and are how they can engage with class activities. It can also have a big impact on how they sleep and just how present they are in other activities across the day. So when we experience sensory input more intensely or differently, it can have a big impact on our behavior and the cognitive load that we take on. It can look like becoming distressed at loud environments, maybe if it's bright lights, maybe certain textures or smells can be really overwhelming. It could be that a child seeks sensory input that can be engaging in behaviors like rocking, could be spinning, touching surfaces to get that sensory input. Children may become overwhelmed in busy locations. They may not enjoy going to the mall. Um, and I think we can all understand that sometimes it's really loud and it can be being in crowded environments isn't that enjoyable. We may see children shutting down in environments where they become withdrawn or absent, or they want to leave the environment abruptly. They may have strong food preferences, and that can be linked to the texture of food, the temperature, the way it looks or smells. And what can help children in these situations? It's important that we can name and validate their sensory experience, that we show them that we can see it's difficult for them, or that we appreciate that we need to maybe make a change to make it more manageable. Occupational therapy can be very helpful because in completing a sensory diet or evaluation, it gives us a plan that we can put in place for the child whereby they will have access to different sensory input at different times of the day. And research shows us that when we do this for children and make these accommodations, it has a huge impact on how much they can attend and participate in the school day. So it's not just extra bits and pieces that we add to the environment. This approach and accommodations are well researched and the benefits are researched and documented as well. And again, these small environmental adjustments that may seem small to us can have huge positive consequences. So it could be wearing noise cancelling headphones, maybe in an assembly time, reducing lighting or give them a space where they can go to where the lighting has been dimmed. We may reduce visual clutter in the environment to make it just easier, maybe on their desk. We remove any excess materials. If stimming is helping the student to self-regulate, allowing them the opportunity to do that, because we understand that when they do that, it helps them to feel more calm and more able to access what's happening in the environment. And we want to also help with creating a predictable sensory routine at home so that children have time to engage in behavior that will help them to feel calm and more tuned into to their other environment, that their environments that they're going to across the day. Okay, so in relation to social communication, and social communication, just to be clear with working with autistic children, it's not that they lack the interest in interacting with other people. Um, they can be very interested in making connections and making friends, but what we see that is different at times is that they are using different types of social language, and how they perceive things can be slightly different as well. And what can that look like? So rather than wanting to talk about general things and having general conversation, we see that there's a preference to talk about specific interests and not small talk. Taking language literally. So when we are using maybe sarcasm or figurative language, the meaning that's implied may be missed at times, and the literal interpretation of what is being said is easier for that child to understand. They may find group situations overwhelming, and prefer to have a couple of good friends rather than having large peer groups. And if you have other children, that can look different to how your other child or other children interact. But it's okay to prefer that, to have that quality over quantity. The communication may appear blunt or direct or overly honest at times, and that can be misread as rude. And the intention may not be to cause upset, but it's being honest, I suppose. And we have to admire those traits in someone as well, because it can uh, ensure that you know where you stand with that person. Although, on the other flip side of that, it can get people into difficulties in social interactions. So, what can help a child with their social communication? What we see is that being clear and explicit with what you say and what you mean. So, saying what you mean and meaning what you say, it helps to reduce the ambiguity. So, there's no double meanings to what's being said. That makes the process of communication more successful. Respecting preferred social pace, and we don't enforce or expect children to behave in a certain way because that's what society dictates. And what we mean by that is the uh, we don't want to make children feel like they can't be themselves in a particular setting. And this can encourage masking behavior or camouflaging behavior, where children are spending large proportions of their day trying to hide what they want, like the sensory behavior that they seek or the way that they want to regulate themselves or engage with others in the environment. And that can be extremely taxing on a child's mental health and also the use of their cognitive resources, because they're doing this over extended periods of time. And often then you hear parents say that when their child comes home, they might just have an absolute meltdown when they get home, or they need a certain length of time to decompress and regulate because they've had a very tough day. So we want to avoid encouraging children to be or behave in the way that we prescribe them to be, and instead trying to provide supports that enable them to regulate themselves and build understanding in the communities around them. We want to celebrate friendships, no matter how different they look, and encourage children to go to places where they're going to have time to engage with like-minded friends. So it could be around particular interests. Maybe your child enjoys going to a Lego club or a coding club, or it could be uh, uh, any different interests and activities that they particularly enjoy. So giving them the opportunity to go and experience all those different things with different people can help to build their confidence and to get more enjoyment out of those type of activities. And often we can find as well there's less pressure on the child because the focus is on the activity rather than the social small talk within that group. Following your child's interests as well, it helps to give us an insight into how they're feeling, what they're thinking, and it's a way to build connection with our children when we can appreciate and be part of their special interests. But if we look at emotional experiences then in terms of intensity, regulation, and meltdowns, it's good that we have a bit of an understanding about what a meltdown is versus shutting down. And when we see a child that maybe has had a long day, they could be when a child's going to school, their day is very busy. Or at nursery, they have lots of different activities. There's a lot of people around. There's a transition in between different activities, lots of smells and sights and things going on, and lots of noise. So that can be stacking up for a child, especially for a child who's struggling to regulate some of that sensory input. And sometimes what can happen is then that they might have a meltdown. So that could look like crying, shouting, screaming, could be rolling on the floor, it could be a physical outburst. Um, and what we want to think about in those situations is how can we better support that child so they're not getting to the point where it leads to that meltdown. And to do that, often we need to have a look at the routine across the day. Is there other breaks, be that a sensory break or a movement break we can give the child earlier on to give them a bit some time outside of the environment. It could be also going to uh, like an area like a sensory room where we have different sensory stimuli. It could be a dim lit room or a dark room, so they're not getting that visual overload. And by doing that and setting up different strategies across the day, we want to get to a point where we don't see meltdowns happening. But often what we see is that something can trigger what it seems like something very simple has triggered a meltdown, but actually it kind of stacked up across the earlier part of the day. And when it comes to that point in the day, then um, they reach their limit. A shutdown is a protective response, so withdrawing from the environment. It could be about going silent, um, and rather than things escalating outwardly, the child is going very still and appearing withdrawn. Um, they may it may seem like that they're ignoring you sometimes, or that they're being shy or even rude. But the what's happening is that the child is trying to protect themselves, and um, that they uh, are kind of using that way to shut down, so that they're not so overloaded with things. And it's important that we know that neither of these is a choice. It's a neurological response. It's the brain's way of protecting the child. And the goal is to prevent things through reducing the load that they're experiencing. And by better understanding the reasons that can lead up to this, it can help us to make changes that will support a child in regulating their emotions in a way that doesn't lead to this. It's good to know as well that research shows us that about 70% of autistic children and young people experience either meltdowns or shutdowns. So it's a very common experience, unfortunately, that children can have, and that oftentimes the shutdowns are happening just as often as meltdowns, but because they're not as obvious or impacting others in the environment, we may not pick up on them. But just to be aware that the prevalence can be quite high. So it's good for us to understand how we can support emotional regulation in a more effective way. So things that we can look at doing are building a calm down plan together when your child is in a good place and feeling regulated. So it's not a good time to step in when a child's in the middle of having a meltdown or a shutdown and try and problem solve. Just like ourselves, if you're having an argument, for example, with someone, that isn't the time to then that you're going to be receptive to being told what you should have done differently or, um, how an alternative way would be more effective. So when we are going to work on a calm down plan, it's good that we do it when the child is feeling regulated and calm. We want to use visual emotions tools and body-based check-ins where we can to give our children a way to explain how they feel without having to use so much explicit verbal language. By using a body-based check, the child can identify on the visual where the feelings are and how it's impacting them. It's a bit more of a concrete way to point out to the locations that they're feeling maybe the stress or um, whereabouts in their body that feeling is happening. When we want to help our children to calm, it's important that we consider ourselves first. Do we need to take a step back ourselves and take some time to calm down before we can show up for our own children? So it's around this concept of co-regulation and supporting our own well-being to enable us to support someone else's well-being. When we get more attuned to the times when we see meltdowns happening, we can think about how to reduce the cognitive load on the child in the run up to that situation. Is there things that we can maybe give them more regular breaks, as I mentioned before? Is it around certain activities or subjects or people that we see the prevalence increasing? So it's good for us to have a think about uh, what key clues are we getting from the environment about things we need to change in order to help our children be more successful. That enables us then to repair and reconnect with the child before we try and problem solve on what happened in that situation, because it's going to be difficult for us to get to the root of things when emotions are heightened. Children may have difficulty identifying emotions, and uh, all we can do in these situations is to, when they're feeling more calm and regulated, is give them the language to explain feelings. And in the meantime, being patient about giving them time to process questions around emotions. Um, and when children say, I don't know how I feel, it's not that they're ignoring you or trying to be, uh, uh, not honest with you. It's that maybe they don't have the language yet to be able to explain things effectively. So we need to remember that and to be patient with what we expect as well. I want us to have a look at these questions next and think about what's the biggest challenge you see for your child right now. So it may be around managing emotions at home, school and learning demands. It could be around social friendships, sleep and routine. It could be around communication and understanding or sensory challenges. So take a little bit of time now and have a think about how that impacts you and your child at home. When we talk about managing emotions at home, sometimes parents say that they see a slow build of dysregulation before we see the external signs of things happening or things coming to a head. And the more we're tuned into that, I think the easier it is to identify where to put supports in place or make changes. So we'll have a look at a couple of strategies after this slide. And then children can have difficulty labeling their emotions and identifying when they're feeling overwhelmed. So this can create situations where we have dysregulation at home. With school and learning demands, then we can see that there's sensory and cognitive and social overload at times, and that can lead to uh, behavior happening at school. And it can be directly tied to sensory overload or social unpredictability. Um, and then off sometimes what we see is that it takes until the child gets home from school before parents experience then the overload that the day has had on them. So what we want to do is keep a log of what happens when your child comes home from school, and then we can go back to the school and discuss that with them. In terms of social friendships, um, you may be concerned about your child struggling to make friends. There can be bullying sometimes at school. And what we find is that when children have at least one high quality friendship, that can be enough. That's can be the quality is more important than the quantity of friendships. And a good way to tackle this can be to look at giving your child access to different hobbies and interests so that they can meet like-minded people, and they're more likely to build friendships with people who are on the same wavelength as them. In terms of sleep and routine, sleep difficulties are reported to affect 40 to 80% of children with autism. And that can be linked to sensory hypersensitivity. It can be um, difficult for children to switch off. And because of maybe emotional regulation issues, it can impact sleep and getting a proper night's sleep. Sometimes doctors will prescribe melatonin for children, but it is good to get professional support with this from doctors or behavior specialists who support sleep routines and will help you to establish hopefully an improved routine at home, because it has such a big impact on the wider family as well if someone is not sleeping well through the night. In terms of communication and understanding, um, we can see that when children are not understanding instructions, or uh, they may not respond well to open-ended questions like "How was your day at school?" Um, Children can find that demand a bit overloading to be able to explain in a sequence of sentences or a narrative format what actually happened at school. Things that may be less demanding are to ask more black and white questions like what did you have for lunch? Who did you sit beside? Um, or even to give your child a bit of time to decompress before we start asking them lots of questions. And what we see as well from research is that it's recommended that we give a child at least an hour to decompress when they come home from school before we start asking questions. And you know your child better than anyone else. For some children, that can be it may be 2 hours they need. So again, just gauge that on your own child and how they're experiencing things. In terms of sensory challenges, then we may find that um, certain food types or situations are causing stress. And if your child is struggling to eat certain textures or foods, it's good to get some specialist help with this too. So the doctor would probably be the best person to start with, but then to look at behavioral specialists or dietitians or occupational therapists often work on uh, food desensitization programs so that we can gradually introduce foods, usually adjacent to foods that they're already consuming and tolerating. And we want to reduce unnecessary exposure to sensory stimuli that the child is overwhelmed with as much as possible. Um, we don't want to set things up that they're going to be avoiding things, but again, we want to try and minimize exposure to sensory input if it's causing a lot of distress. And that's things like using maybe noise cancelling headphones at times, giving them advanced visual preparation about where they're going to be going to next. So maybe using some pictures, um, telling them how long they're going to be doing something. For example, we're going to the supermarket, we're going to go for 15 minutes. We need to buy this, this, and this. And then after that, we'll be coming back to the car and we'll be going home. So again, we're giving them some warning about what to expect, and that can help them to better prepare themselves for the changes in the environment. Some other then practical strategies for home. So we want to make things small and manageable, but then hopefully have a big impact as well. So to build predictability and routine, visual schedules are important. They help the child to understand what's going to come next in the routine. It'll give them advance warning of changes, and that can help to reduce anxiety. It's about then, even ourselves. I know that I use a diary and a calendar, and I schedule things across the day so I know what to expect. That way you can be prepared for meetings, for example, or if you have to go somewhere that you give yourself sufficient time. So being or having that schedule helps us to feel more calm and that we know what to expect. And our children are no different. In fact, they need more visual support so that they can be prepared for things that will happen in the routine. And then it's also good for them to get experience of the routines or the plans changing and how we manage those situations as well. So when we are communicating with our children, we need to give them sometimes instructions in a reduce the length of instructions and the complexity. So think about the number of keywords you're asking your child to follow. Um, for example, get your shoes versus go up to your bedroom, look behind your bed and get your shoes and bring them downstairs. That they're very different instruction lengths, and the key piece of information, getting the shoes, is the same across both instructions. So as much as we can, we want to get to the key words in the instruction, and we want to give children extra time to process instructions and have that understanding that silence or a lack of responding may be that they are processing that information. So it can be helpful to count to five after we give the instruction, support it with writing or visual supports, if spoken word is overwhelming, and that increases the chances of them being successful. We want to follow the child's interests, because these special interests can be a great source of enjoyment for our children. It's a great opportunity for them to learn about themselves. It gives us an opportunity to engage with them around something that they're interested in. For example, if they love dinosaurs, maybe you can look at the dinosaur book together, and maybe rather than asking lots of questions about dinosaurs, we try and give them the space and opportunity to talk about them themselves. So in doing that, we're getting more of an insight into what they enjoy. And when we are doing or enabling children to have that structured time around their special interests, it can be a much more uh, relaxed way for them to make friends, and there's less of an expectation that they're going to have long conversations or small talk because items and activities are focused around that topic of interest, and it reduces the social pressure that way. When we are supporting children and managing a transition, we need to think ourselves about how we can warn the child about an upcoming change that's coming. It can be using a visual cue or a timer before the activity changes. And that way we're giving them some preparation time. And it sometimes it's unavoidable that things can change quickly or we're in a rush, and that happens. But as much as we can, trying to give them a little bit of time to get themselves ready for the upcoming change can make the transition smoother. After a difficult moment or um, maybe it can be an argument, or we all lose our temper sometimes as well. So if that happens, it's okay. We just need to try and think about how we can show our children that we also make mistakes. So it's about being honest sometimes and saying, uh, I raised my voice there. I'm sorry. I didn't mean to cause you upset, or I didn't mean to overwhelm you, and I will try and do better the next time, so that they can see how you go about repairing a situation where you didn't maybe act in the best way, and they can see you taking ownership of it and try to take steps to repair it with them. And then later on, when things are calmer and everyone's feeling a bit more regulated, we can talk about how to improve that, or avoid that situation happening again the next time around. So we reflect at a later point when we're all feeling a bit happier. And being able to admit to our mistakes and saying, I'm sorry, is really important as well. Uh, so when we are thinking about making home a safe space, when children have been at school all day and in a busy routine of following lots of instructions and doing lots of different kind of work, we should allow them to feel like home is a place where they can recover and decompress. We don't want it to be an extension of school. And that may mean that we need to speak to school about reducing the expectations around homework and having some flexibility with that. Um, Children may just be at the max capacity by the time they come to home, being back at home, and we need to give them that understanding and space to do that. We can try and adapt activities sometimes, or just to not have it on the schedule for some time, because it can be better for the child themselves and the overall family dynamic if that extra pressure isn't there, for them having had a long and busy day at school. So it's good to have that dialogue with school and explain to them what you're experiencing, and again to document what you see happening so that you can go back with that evidence to school. So some questions to ask yourself. Take a moment to consider each of these questions. There's no right and wrong answers, but just to think about it for yourself, it might help or change how you view things, and maybe you can try and do things in a slightly different way. So number one, when my child has a meltdown, what is my first instinct? And does it help or escalate things? Number two, does my child have some decompression time after school before I engage with them? Um, Number three, do I engage with my child's special interests, or do I try to redirect them? Number four, am I telling my child what not to do more than I am telling them what to do? Number five, does my child have at least one space at home where they feel completely safe and in control? Number six, am I taking care of my own well-being so I can be regulated enough to co-regulate them? Probably one of the most important things to ask ourselves as well. Are we making time enough for ourselves so that we can show up in as well as we can for our children? When we talk to school teams, so our child's teacher or the special needs coordinator at the school, we are as parents the most important advocate for a child, because we understand them better than anyone else. Um, and we need to be confident when we ask for adjustments to be made, that what we're asking for is reasonable. And I think probably from the session today, it's a practical thing to take, what you can ask for from school, and hopefully you can work together to get some of these things met. When we ask for a safe and quiet space for our children to decompress, we know it will help them to reduce the sensory overload. And we know that it can show measurable improvements in attention, memory consolidation, and participation in class activities when they have that space to decompress. We want to pre-warn the child. Can they be given more warning of changes to their routine? And then reducing this anxiety around transition or things being unsuccessful can be significantly reduced when children are given appropriate warning time. Written instructions as well as verbal instructions help children to process what they've been asked to do. It reduces the load on working memory, where they have to recall a longer instruction rather than when they see it in writing or with a visual support, it gives them extra time to process what they've been asked to do. We want to encourage flexible seating away from busy, maybe loud parts of the classroom, maybe away from the window, close to the whiteboard or to the teacher's desk. Um, and then it gives them more of a chance to be successful that way and reduces sensory distractions. Is there a named adult the child can go to? Having that consistent person that they can rely on can help to reduce social anxiety significantly, because they know that they have that person that will understand them and that will help them to maybe formulate how they need to say something so that they can get their needs better met in the environment. Can they have extra processing time in assessments? And this can help with compensating for the sensory and social management pressures that a student is facing or navigating, and give them some extra time to think through questions and give the best response they can so that they can show what they know and what they can do in the assessment rather than having to do things in a time manner that can put them under extra pressure. Okay, so we're getting towards the end of this session, and one of the most important things to touch on is about the positive autistic identity and how protected that is for children. So when we can support this and develop this, we know from research that that can be really protective for a child's longer term mental health and well-being. And uh, what was it going to say? So more protective to well-being, but also to set themselves up to be able to advocate for themselves as they navigate through different situations. Things like using positive language, so it's saying things along the lines of your brain works differently, and that's okay. That's a very different message for a child to internalize than we need to work on this or we need to work on this difficulty that you're having. And when we are saying this type of thing to children, that's the voice that they hear in their head as well. So we need to keep that in mind, that we give them the positive language to believe in themselves. And going back to the video that we watched, having those high expectations of themselves and that other people expect them to succeed is very important, because it can help us to give things our best shot and to realize that we'll be supported whatever happens. We want to find autistic role models. So some people here, we have Temple Grandin, Greta Thunberg. You might have found other people yourself or know people in your community that you can remind your child about, that they can think about those people because they can see then what's possible for them, and that we see successful autistic individuals across all walks of life. Connecting within our communities then, so looking at autistic led organizations, support groups for you and your child. Lived experience is often more helpful than clinical descriptions, because we can see that how individuals have navigated different situations. And we want to avoid the masking trap. And again, we've touched on this today. We don't want to make our children feel like they have to suppress or hide what they naturally want to do. And that can be very damaging to mental health in the longer term. And we want to make children feel safe to be themselves and to regulate in the ways that they want to do that, so that they can get more from their environment. When we take that pressure away from children to mask, we see that it leads to much better long-term mental health outcomes. And by developing this positive autistic identity and developing our children's understanding of themselves, it helps them to be able to speak up for themselves in different settings. So when they go to university, can they ask for extra help? When they're in the workplace, can they ask for information to be uh, given to them in writing, not just spoken verbally in a meeting, because they know they're going to be more successful when it's done that way. So it's having the confidence in being able to speak up for ourselves and know that we're well within our rights to ask for those things because we know that that works for us. Then just to finish up, one thing I will do differently for my child this week. So one thing at home, maybe something in your communication, something at school. And you can write this down yourself um, now and maybe pause the video and have a think about one thing you can do differently for your child this week. In terms of questions, some of the questions that we can be asked, and I want you to, we may not cover the questions that you have yourself here at the moment, but if we don't cover something that you want to ask, feel free to leave it in the comments or to email me directly or to contact the phone number there. Should I tell my child about their diagnosis? And we can know from research that it's very much encouraged that we tell children from a young age about how their brain is processing things, builds their understanding. It goes back to this positive identity and understanding of ourselves. It helps us to reduce the self-blame that we might engage in and feelings of inferiority. So why do they find it so easy to do that? Am I not as smart as that person? Or why do I really struggle with this? When we build that understanding of how our brain works, it helps us to be kinder to ourselves, and that leads to long-term better mental health outcomes. And this can be done through support in our community as well. And get we can try and access some advice around, having that conversation. But rather than it being this big conversation that we talk about these things openly as a regular part of life. Will my child always need this level of support? And the honest answer to this and the research backed answer is that it depends on how your child makes progress in what supports that we provide to them. We will see children across the board making progress. However, some children are going to do it in different stages, and different supports are more beneficial for different children. So again, when children are younger, the best practice is to engage them or give them access to early intervention, because we know when our brains are developing, they're more malleable and can be adapted. So then when we try and teach skills at a younger age, it's easier for children to learn those skills, and it gives them a solid foundation on which we can build. So it's good to keep that in mind, early intervention and why it's supported and recommended. Um, so what we can see then over time is that children, the level of support they need can be reduced down. Again, it depends on the child. Some children are going to make progress at a faster rate than others. But I think it's good to have a think about where your child himself wants to get to, and having some kind of goals in mind, but trying to be realistic as well, so that we're not setting them up for huge high expectations that they may feel like they're not going to achieve. So getting your child involved in that conversation is really important as well. And again, when we build these self-advocacy skills, it helps children to be able to communicate what they want from the environment and what will help them within that environment, so that they can get the supports themselves. And that helps to build success and independence in the longer term. So when we think about, and I don't mean that not to be given a clear answer, uh, there is so much research there that says that improvements will happen and that supports may change as the child gets older. Um, but it's about trying to give them supports when they need it and when they're going to get the benefit from it. So that we can, with the aim, the longer term, to reduce down the amount of support required. What if the school doesn't listen to me? And this can be a concern for parents, especially if they're finding that their child is having a lot of meltdowns after school, or when they come home, they see that there's a lot of behaviour and they're concerned. What I would suggest is writing things down and documenting what you see and what your child says, and scheduling regular meetings with school, giving them the opportunity to put the accommodations in place that we talked about earlier. Uh, you're going to be advocating on behalf of your child, so it's totally acceptable for you to ask for some of these extra supports to be put in place. Ask the school what their stance is, what supports do they usually provide, how can they help you, and try and have a collaborative or discussion and arrangement in place where you're part of the goal setting and your child is part of the goal setting as much as possible, but that you have scheduled meetings and that things are done in writing as well, and that you can back up what you're saying with examples that you've observed yourself. How do I talk to other family members who don't understand? And I think this is can cause a lot of stress, especially if we're based here in the UAE. You're not getting to see family members in other countries as regularly as you would if you were all living in the same place. So then you have these big lags of time. So maybe it's a 6 months or every year that you're going back to your home country for a little while. Um, and I think it's good to, I suppose, be honest with people about where you're at. Uh, for example, we've just had this diagnosis. I want to let you know about it, and I want to get you to understand where we're coming from so that we can all be on the same page, because this is going to help them the most. Um, and keeping things specific as much as you can, and what you can see is working for them and what's not working. And then giving family members that advanced warning that when you see that your child is maybe struggling, that he might need to take a break from the activity, or it could be if it's a family dinner or whatever the event is, that you're going to be honest about, you'll be doing things with their best interests in mind. So that it's pleased that you need other family to understand that, and that you welcome their support in doing that, and you're giving them then the high expectations you have for them. Not everyone is going to be understanding, and that's okay. That's their, that you can't make them see things in the same way as you. What you can do is be clear on what you're going to put in place to support your child, and the boundaries that you're going to put in place in what you expect from them in that situation, and ask for support from other people. And that sometimes I think, from feedback from families and parents, they can be surprised sometimes at people who do actually show up and are supportive, that they didn't expect. But on the other hand, we can have close family members that don't understand and don't provide the support that we hope they will. And unfortunately, there's not much we can do about that. But again, it goes back to the idea of self-care, looking after yourself, and understanding what the limits of what you can do and what you can expect from people are, and making sure that you look after your own well-being, because then you're going to be more effective at being clear in how you communicate your needs and your boundaries to other family members on behalf of yourself and for your child. But I know that navigating some of these things isn't easy. And I don't want to be oversimplistic with some of the suggested answers, but I just wanted to give you some things to think about, and hopefully some things that may help in your particular situation. Okay, so we talked about a lot of things today, and just to kind of sum up some of the main important things that we touched on. Um, and we talked about understanding and accepting, your child's autistic experience, and that means looking at our own emotional reactions to things, that our feelings are are totally valid. We're going to go through different stages and different emotions. And we want to give ourselves that space to do that. And the understanding that, for you to be able to show up for someone else, you need to give yourself that room to feel what you are going to feel. Um, and again, we want to be able to support our child in being and expressing themselves as they are. We looked at different strategies for home and school around things like emotional regulation and communication and managing the routines and expectations of the environment. Um, and I think we need to be confident in our ability to ask for things that are reasonable adjustments to the environment to help our children to be more successful at school. And again, probably one of the most important things we touched on is about building a positive identity for our children of being autistic and what that looks like, so that they can better understand themselves and be able to have the ability to speak up for themselves around what they're going to need. And we know that if we can do that from an early stage, it is protective for mental health in the longer term. So I hope that information helps. And again, if there's something that we haven't covered today that you would like more information about, or you have any feedback, any comments yourself about your own experiences, we'd love to hear from you.